because we're minus seconds already. But let me give you 30 seconds each to at least try and respond to something.
Number one, mental health. Absolute supporters of mental health. I think the Mental Health Act that's being pushed in the Senate is one that's absolutely needed, and we are strong supporters of it. I think the education and awareness component of it is huge, and it's an important foundation of the bill. On the our enterprise role, private sector's role, we cannot prescribe, right? I mean, we're one group. Everyone has to look at healthcare in their own individual enterprise way. At the minimum, I would hope that large corporations in the Philippines, I know the big corporations, the Shells of the world, the Finmans of the world, look at healthcare as a benefit to their employees and provide those benefits to their employees. At the minimum, it should be that way, no? But ideally, that more institutions look at healthcare as a real sector and as a real benefit and a right for the employees. The third, I'll just address very quickly, Runa. Private sector versus public sector. It's always a tough balance. No? We, in everything that we do, we try to complement, not supplement government work. No? So in our primary care centers, which are in urban communities, it is not to displace the barangay health center. No? It is to complement the barangay health center, where sometimes you have non-existent barangay health centers or poorly equipped barangay health centers, but we work very closely with the LGU. But having said that, I think it's private sectors. I would be naive to think that the private sector can do everything. To your point, there are things that the NGO community should be looking at. There are things that the government should be looking at, and there are things that the private sector can look at. Just one very quick anecdote, bro.
Really?
But affordable medicine, for instance, we can only do so much with our generic pharmacy chains. There's many more millions of Filipinos who do not have access to affordable medicine that we cannot reach, unfortunately. And who does that?
How many more issues can we cover? This is amazing. Ronnie, can ask one?
Please don't misunderstand by saying or misunderstand that we only do whatever we can and nothing more than that. We look at the whole totality, and every one of us, every sector, which includes the government, the main responsibility is the government's responsibility and individual responsibility. So, family to the government, and in between, each sector will do what they are best equipped to do. Because you need to go to a hospital, and if the hospital is for limbs, it has to be first class. If the hospital is for only doing heart surgery, first class. You don't want to go somewhere and they try to do everything and nothing is done well. So dependability of service can only come when you have a very clear vision of what you can do and where you are striving towards. And together, which is inclusivity again, together you have to build the system. Not one individual, but together.
Thank you, Chung, if you get a very brief last comment.
Okay, I think I want to go back to the future. I'll go back to the future issue. I am actually quite excited and optimistic about the future. We already have a lot of solutions, and it will be more and more coming up. But I think my main concern is whether it will be more inclusive or less inclusive. I'm more pessimistic that in 20 years or in the future, we have more treatment available for many people, many illnesses, but it will be less available to people, and that I think is the tragic. Is my concern. Yeah. If you can afford it, you have a lot of things can be done, but most people cannot afford it.
You can see we've covered more ground than we have time for. Thank you, panel. Thank you, audience, for all these things. Believe it or not, I had found out that both Chung and Paolo are going to be in Boston this week, and Runa is coming next month. So I will see all of them very soon. So again, thank you. We can pick some of these things up, by the way, tonight at the gala. And so feel free to interact with any of the panels. Thank you again.
Thank you very much to our esteemed panelists as well as to our moderator.
Hi, I am with Mr. Chung from Heng Foundation. Hi, Mr. Chung. Welcome. So you are speaking at the healthcare session. Maybe since the topic is on can healthcare be more inclusive, what are your thoughts about how can we make healthcare more inclusive?
I think healthcare can be both inclusive and good, but the question is not whether it can be both, but the question is whether it can be affordable in order to be both, and affordable to the government and affordable to the people. And we have seen many models that healthcare can be both inclusive and good. And the second question I always ask myself is that although it might be inclusive and good, can it be better with less money? And I think there are many pilot programs run by NGOs which are actually with very little additional cost, but they dramatically enhance the quality of the healthcare product. So that's something I think we should focus on. Yeah.
Thank you. So you are an awardee of the Ramon Magsaysay Award. Tell us more about the work that you do and how you are actually supporting the community.
I'm very fortunate to be able to become an awardee of the Magsaysay Award. In the past 20 years, I founded a foundation based in China to support HIV-related causes, most notably providing education and psychosocial support to children impacted and also infected with HIV. Cumulatively, we have support over 21,000 students in China.
21,000 students. Where have the students now gone to?
Many of them have graduated from university. I think we are very proud that we have a university entrance rate at over 60%. If you look at the first batch of students that we sponsor, which is about 7 times higher than the national average in China for rural China. In addition, we believe that not everybody needs to go to university, so we build also vocational training programs to train them to learn a skill set so that they can have better development, including a bakery school that we run in Shanghai. We also believe that education should include an education to have a stronger, more self-confident personality and also a sense of social responsibility. So we have a Heng Academy which try to motivate them and empower them to have more personal self-development.
Awesome. So this is about developing young people. So the theme today is about, reimagining the future. What are your thoughts to the theme? How do we actually reimagine the future?
I think I'm quite optimistic about the future because of advancement in artificial intelligence, in healthcare, in all kinds of IT. It would dramatically change our life. But my concern is if we think about 20, 30 years or even longer down the road from now, which actually is not very far away, my concern is, and my worry is that all these good things may not be accessible to people, and more people are left out for the good things. So 20, 30 years from now, what I don't want to see is that we have very good medical solutions to cure certain disease, but it costs so much money that most people in the world cannot afford it. And that would be the sad thing. So how to have the accessibility is more of a concern than the technology advancement.
So how do you think that can be actually resolved or rather minimized? Making sure that the marginalized people are able to also I suppose, afford technology, or rather embrace and also get the technology that's only available for the higher up?
That's the hard thing, because nowadays a lot of the, for example, the medical treatment, the pharmaceutical treatment require certain patent restrictions, and making generics is not available in many places. So sometimes people are left out from something is already available, and a lot of people become sick or even die because they cannot afford something which is already available. And I think that obstacle has to do with a lot of commercial companies and also international regulations. And I think those two has to have some breakthrough.
Thank you very much. Now, one last question. How do you think you would like to shape the future personally?
Over the past 20 years, I worked closely with a group of very underprivileged populations. They are underprivileged not because they are impacted by poverty and also by illness, but also by social stigma and discrimination. And I think in the future, a lot of people should not be left out, not just in terms of accessibility to healthcare, to internet or high tech, but also just by social inclusion. Especially in Asia, we have seen a lot of people being deprived from reaching their full potential, whether because of their gender, because of their sexual orientation, or sometimes their religion. So I think as an NGO, we would keep working on that, and I really hope we can have a more diversified and inclusive society.
Okay, last but not least, what is your personal definition to what greatness of spirit means?
I think nowadays the consistency in dealing with an issue, not to give up easily, is something I think of very high quality, because a lot of people are doing good things, but I think we don't actually value the time of doing this as much. So I really admire people who not only be very smart and capable, but also to be very stubbornly addressing something and doing something consistently for a very long time. And I think this kind of long-term commitment is something which I think is increasingly rare in the society. And I think we should not give up easily when we face obstacles, especially when we are fighting for a good cause. And I see so many cases, and especially nowadays, increasingly more people are giving up easier than in the past. So I think this is the quality, the commitment, and the stubbornness to continue is something that I think is getting rarer, and also should treasure and value.
And we are back to the Future Reimagine Conference, and joining us in our Imagination Hub today is Miss Runa Khan from Friendship. Good morning, Miss Runa.
Morning. I'm very happy to be here. Thank you.
We're so happy to actually have you join us this morning. Okay, I'm interested, for the sake of our audience, can you tell us about the very interesting work that you do?
You know, I started my work with a dream of being part of building a world where there is opportunity, dignity, and hope for people. And truly, I started with trying to figure out, why is it that this whole world, which is so filled with so much money, so much of good intentions, people wanting to do good, then where are the gaps which are happening? And I found that, I needed to start where I could start. And I started with the most inaccessible and remote communities of Bangladesh. So I started the first mobile floating hospitals. And, in the beginning, you start with one thing and you think that, okay, you've done something and it's very good. But then very soon you realize that, when you're dealing with very remote areas, very remote communities, it's more than just doing one thing. You need to give them the right thing in the right way, in the right amount, and it involves all the social security networks like health, education, access to finance. And that's what we started doing and building. So,
Wow, I can see so much passion and positive energy that you exude while just talking about your work. And I'm interested into, with the course of the work that you do, what has been the most profound or impactful personal experience you had?
People ask me that, what are the difficulties I've faced? What are the things that have impacted me? What is the one thing that for which I started? But actually, it's not one thing, because every day you're facing things which are making you do a little bit more, which is changing you, which is making you feel that whatever you do is nothing. And then you see a child who couldn't walk or who couldn't see, and then he can see again, and then you feel that you've done something and this is it. So I think the work that we do, each case, each person that we touch, the lives that we touch, I think that is the most impressionable, challenging, and the most beautiful thing that I face every day.
And that's a very, very good story you have there. And I'm interested to know, how does the future look like for disadvantaged community if you are going to design it?
The future. One, as I said, wherever you are, you think of the future from that point onwards. So, if you are involved in technology, it is better technology. If you are involved in climate change work, it is seeing a world where, things are predictable and the weather is fine and the whales are still there and, life is existing on this planet. I start from a very simple thing. I start with incorporation of everything that we're talking about. For example, because I start with people who've got nothing. So for them, my imagination is to ensure that whatever we give them, that can be sustainable in the future, so that they can move up and become part of the mainstream of this world. And it is not a community, one community. It is not 100,000 people or 2 people or 3 people. It is millions of people all around this world who are in the same, in the same contextual environment. And, it's all very beautiful. We've got the first, the VSATs in the country, maritime VSATs, French, we have put it up. We are working with technology. Our supervisors are having their laptops and their, technology is part of our life because we need it to improve. But it's only a tool. Like even dealing with climate change, ensuring environment is good is a tool. At the base of it is ensuring that human dignity is sustained. And that is what we try to do.
Wow. I'm actually having real goosebumps right now because I exactly are on that situation right now. We also work with people with medical, psychosocial, and physical disability. And you are such a great inspiration for young change makers. And thank you so much for the work that you do. And my final question will be, what is your commitment to the future and making sure that no one is left behind?
It's to take it step by step. You have to have your vision in the stars, and you have to have your foot firmly in the ground, in the mud. And that in the mud, not even on the ground, because otherwise you can't go step by step. So to ensure that communities all over the world can be dealt with dignity, can be dealt with kindness, that love and respect goes beyond simple service delivery. I think that for me is the world I want to see. I want to see a world where there's empathy, where there's humanity above everything else. You can train people, you can have awareness campaigns, you can have incredible service delivery. But at the end of the day, if you don't take care of humanity and nurture the human values, you will have a world where nothing means anything. So that is the world I want to see.